Good evening, everyone. Welcome to our Revolution Northern Virginia's meeting. This meeting is being recorded. I'm Sandra Klassen, the meeting moderator, ORNOVA chair, Bernie 2020 Virginia campaign co-chair, and 2016 and 2020 National Sanders delegate. Thank you for joining us tonight. We hope to see you at future meetings as well and invite you to become active voting members or allies. Voting members are defined as those who reside in Virginia jurisdictions, CD 8, 10, 11, or Prince William County 1, who have attended a minimum of 2 previous organizational meetings and have completed our membership form at www.ourrevolutionnova.com. Allies don't live within the eligible jurisdictions in order to vote, but you will receive information and invitations to attend our meetings. We are an issue and policy, not an operations focused organization, committed to advancing the progressive vision and evolving movement sparked by Senator Sanders' presidential campaigns, his current work as Senate Budget Committee Chairman, and his overarching progressive vision. The objective of this movement is to advance policies grounded in economic justice and to reform those rigged and predatory aspects of our economic, social, legal, and national security systems that impede these policy goals. For our speakers, our meeting will be structured into 3 parts. First, each speaker will present in-depth remarks about their topics. After the individual presentations, the 2 speakers will engage in an unstructured roundtable discussion on the topics with each other. And finally, during the 3rd Q&A speaker segment, steering committee members will ask questions of the speakers. During the presentations and roundtable discussion, meeting attendees are urged to please write your questions in the chat. And if you want to specify, please specify to whom your question should be directed. Steering committee members will be monitoring the chat throughout and will select some of your questions for the Q&A. So let's begin the program. It is timely that during this current annual Medicare open enrollment period, we're here to examine how the scam Medicare Advantage plans and the recently and covertly deployed direct contracting entities are actually equivalent to Trojan horses in the unrelenting corporate war to kill and privatize traditional Medicare. They have already surreptitiously infiltrated and captured so much territory that the war is nearly lost. Well, most Americans don't even know it's happening. Our first speaker is Thom Hartmann. Thom is a New York Times best-selling author of 30 books in print and the #1 progressive talk show host in America for more than a decade. Thom has co-written and been featured in 6 documentaries with Leonardo DiCaprio about climate change. A former psychotherapist, entrepreneur, and refugee worker, helping the worldwide Salem Group start homes for abandoned and abused children all over the world. Thom and his wife, Louise, live in Portland, Oregon. Referring to his new book, The Hidden History of American Healthcare, Why Sickness Bankrupts You and Makes Others Insanely Rich, among other disturbing healthcare realities, Thom will highlight and expose Medicare Advantage plans, the massive trillion-dollar ripoff of the federal government, taxpayers, and most of the people purchasing the plans. Over to you, Thom.
Thank you. Thank you very much, Sandra. And it's great to be here. I'm a big supporter of Our Revolution, been in on it from the beginning, and it's an honor. Thank you for inviting me. I want to start by just telling a quick story about a friend of mine in New York City. I knew Sam back in the 70s, actually, in New York. We used to hang out down in Greenwich Village together a lot, and hadn't been in touch with him for years. And a mutual friend of ours was telling me about this. This was late last year, that he was having trouble urinating. He went to the doctor, got a PSA test, and it was like in the hundreds. It was just, it had exploded, his PSA. And they said, you've got prostate cancer, you got to do something quick. and he had no insurance, but he had just turned 65 a few months before that, and had tried to sign up for Medicare online, had gotten totally confused and just gave up and thought he'd do it later. So the doc in the box that he went to for the $50 exam said, "Oh, well, we're affiliated with a hospital. It's got a Medicare system, and we can sign you up right here, right now. It won't cost you a penny." And so he signed up for a Medicare Advantage plan. And then he asked the nurse who had seen him, or I guess it was a physician's assistant, where he should go for good cancer treatment. And they said, well, Sloan Memorial Kettering Cancer Institute here in New York City is the best literally in the world. And they take Medicare, so you should go there. So he made an appointment with Sloan and showed up a couple of weeks later, told him he had Medicare, showed up a couple of weeks later and discovered that Sloan was not in this company's plan. They would not pay for him to go there. In fact, none of the Medicare Advantage programs, he was signed up for Medicare Advantage, not Medicare. He didn't realize there was a difference. None of the National Cancer Institute, what is it called? Yeah, National Cancer Institute centers, which are all around the country. Sloan is the big one in New York. None of them take Medicare Advantage plans in the New York City area. And so Sam went back, and it was just before the end of the year, and he was able to get himself on regular Medicare, but nobody told him he needed a Medigap plan. And so he then tried to get a Medigap plan, but because he had already signed up with Medicare Advantage, he had to disclose his health status and the Medigap providers, and he just got into some horrible loop there. And when I wrote this piece back about 5 months ago, he still hadn't seen a doctor. I understand from our mutual friend Jerry that Sam has now seen a doctor, and he's in really bad shape. But this is the kind of thing, Mark Miller, writing for the New York Times in February of last year, wrote about Ed Stein, a 72-year-old man who had bladder cancer. Same deal. He ran up as Miller, and what he found was that the cancer docs in the area where he lived, who specialized in bladder cancer, didn't take this particular Medicare Advantage plans. None of their docs were in that plan. So he tried to shift back to regular Medicare. And as Mark Miller writes in the New York Times in February 2020, quote, "That was when he ran up against one of the least understood implications of selecting Advantage when you enroll in Medicare. The decision is effectively irrevocable." So once they've got you, particularly if you get sick after they've got you, it's very, very difficult to get back on regular Medicare or to get a Medigap provider, because when you first sign up at 65, the Medigap providers have to insure you regardless of your health condition. After you've been with Medicare Advantage, they don't have to insure you regardless of your health conditions, and it can get very, very chancy and dicey. So last Friday, a week ago, the Centers for Medicare Services announced a 14.5% increase in Medicare Part B premiums, raising them for the lowest income recipients from $148.50 a month to $170 a month, which is not a lot. It's less than $20, but or less than $30, I guess. But if you're living on the lowest level of Social Security, which is $365 a month, that's a hell of a lot of money. So why is Medicare raising prices? Well, the public reason is because of this new drug for Alzheimer's, which is $50,000 plus a year for treatment. But the actual reason is that Medicare Advantage plans have been just draining the Medicare Trust Fund dry. These plans, because they are private, typically for profit, there are nonprofit ones as well, but the vast majority of them, and the ones you see advertised on TV, are private for-profit businesses. And they run health insurance the way it's always been run. That is to say, everything has to be pre-approved, and they very often turn things down. And if you show up and your anesthesiologist, who you don't even know, turns out not to be in network, you might end up with a $10,000 bill, and all these kinds of problems. But the biggest scam here with regard to Medicare Advantage is that the plans are not reimbursed by the federal government based on the actual expenses. In other words, if I go and get back surgery, as I did a couple of years ago, if I was on a Medicare Advantage plan, they would not be reimbursed by Medicare for that. But similarly, if I just needed back surgery but didn't get it, oddly, they would be able to be reimbursed essentially by Medicare based on the fact that I had a higher risk score, that I had an illness, as it were, or a problem. And to really get this scam going, what these companies have been doing is there's a whole mini industry that has evolved of nurse practitioners and physicians assistants who go out to people's homes and do a home visit, which is sold to Medicare Advantage customers as a benefit of the plan. And really what they're looking for are things that they can use to upcode to make it seem like that person is sicker. For example, if they'll say, have you been feeling kind of depressed? Well, yeah, COVID is kind of getting to me. Well, how long has that lasted? Has it lasted more than 2 weeks? Well, yeah, it's been a couple of months. Cool. Because less than 2 weeks of feeling depressed is considered transient depression and doesn't raise your risk score. More than 2 weeks is considered major depressive episode and substantially raises the amount of money that the Medicare Advantage plan gets from the federal government, even if they provide no services. Similarly, a little tick on an EKG that could be problematic decades down the road can be upcoded as heart failure, just like full-blown heart failure. There's essentially no distinction between the two in terms of the reimbursements. As a consequence of this, in 2014, the Center for Public Integrity published a piece called "Why Medicare Advantage Costs Taxpayers Billions More Than It Should." They pointed out that just between 2007 and 2011, the risk scores of Advantage patients rose sharply in over 1,000 counties nationwide, boosting taxpayer costs by $36 billion over the cost of treating those same people with standard Medicare. They also found that in 200 of those countries, the cost of Medicare Advantage plans was 25% higher than the cost of standard Medicare. Patients, by the way, never know what their risk score is. Their doctors are not even told what the risk score is. This is purely between the insurance company and the federal government. In 2009, government officials estimated that they were paying just over 15% of that just over 15% of total Medicare Advantage payments were inaccurate, about $12 billion that year. And but we say inaccurate, we mean the insurance companies are getting more money than they should. The Center for Medicare Services estimated that, quote, faulty, end quote, risk scores triggered nearly $70 billion of, quote, improper, end quote, payments to Medicare Advantage providers between 2008 and 2013. During that period from 2008 to 2010, the Centers for Medicare Services determined that they had paid out $32 billion that they never should have paid out. They're paid out a total of $150 billion in 2014. It's substantially more than that now, of course. Then the Office of the Inspector General for HHS, which oversees Medicare, audited out of the hundreds of plans available in 2007, they audited 6 of them. They found that just those 6 companies have been overpaid $650 million. They sued and settled out of court for $1.3 million, which is typical. Typically, they settle for pennies on the dollar. Nobody gets their hands slapped. There's no penalty to these companies for lying to the federal government. If they get caught, they have to pay it back. So in 2020, the Center for Medicare and Medicaid Services, CMS, decided that of the roughly 300 or 400 at that time Medicare plans on the market, and there maybe will be over 1,000 now, that they would only audit 30 plans a year. At that rate, as the Center for Public Integrity noted, it would take CMS more than 15 years to review the hundreds of Medicare Advantage contracts now in force. And that's 15 years to audit just 1 year's activity. So in other words, these people are operating with complete impunity. Sherrod Brown wrote a letter to CMS in September of 2019 saying, quote, "The recent HHS payment accuracy report exposes that taxpayers have overpaid Medicare Advantage plans more than $30 billion over the last 3 years. And he wanted to know what they're going to do to recover the money. He never heard back from them. This was the Trump administration. Meanwhile, under the Trump administration, Medicare, the Centers for Medicare Services changed their pages on the internet. So now if you go to sign up for Medicare, you get directed to a page trying to sell you Medicare Advantage, which is nuts. The National Bureau of Economic Research, the NBER, looked into this in 2020. And what they found is, quote, Medicare Advantage insurer revenues are 30% higher than their healthcare spending. In other words, they've got a 30% profit right off the top. Healthcare spending for enrollees in Medicare Advantage is 25% lower than for enrollees in regular Medicare. So people who are on Advantage plans are receiving 25% fewer payments for services. People with Medicare Advantage got 15% fewer colon cancer screening tests, 24% fewer diagnostic tests, 38% fewer flu shots. So, you know, it is the scam that for-profit insurance always was. And it's now over 40% of all the people who think they're on Medicare are actually on Medicare Advantage, which means that the privatization of Medicare, this all started in 2003 in a big way. Medicare Part C had been there since the George H.W. Bush administration, but George W. Bush authorized, you know, under the Medicare Enhancement or Improvement Act of 2003, whatever it was called, that said that Medicare couldn't negotiate drug prices anymore. They also allowed private insurance companies to use this term Medicare Advantage as if it's Medicare with something even better, which it, you know, clearly isn't. So my concern here, and I think Sandra just expressed it fairly well, and I'll wrap up with this, is that when these guys get to 50 or 60% of all Medicare recipients actually being on privatized plans, which I think may well happen at the end of this enrollment period or maybe at the end of next year. I mean, they're hoovering up people like there's no tomorrow. I had a woman call into my program on Friday and say that she was keeping track of it. She'd gotten 243 phone calls from people trying to sell her Medicare Advantage over the course of the last 2 months, which is mind-boggling. If they're, you know, over that 50% threshold, I could see, if we get a Republican administration in 2024, which I don't think is out of the possibility, I could see them, and Republicans take back Congress, just saying, cool, you know, people prefer Advantage, we're just going to retire conventional Medicare, it's going to go away, and that'll be the end of it. And then the Republicans will come out and say, you know, this Medicare for all, it's a really good idea, let's just sign everybody up for these Advantage plans and do away with the age limit. And suddenly we're right back where we were before the Affordable Care Act. So anyhow, that's my rant, and I'll toss it back to Sandra.
Thanks so much, Thom. We look forward, I guess, to hearing more from you later in our program. So now Dr. Anna Malinow is our next speaker. Dr. Malinow currently lives in San Francisco, where she's the clinical professor of pediatrics at the University of California in San Francisco. She received her medical degree from Case Western Reserve University and her training in pediatrics at Rainbow Babies and Children's Hospital. She is past president of Physicians for a National Health Program and currently serves as an organizer for National Single Payer. Dr. Malinow has spent decades working with immigrant, refugee, and other underserved populations. In Houston, she co-founded the Healthcare for All Texas and Doctors for Change to improve healthcare access to Houston's 1.1 million uninsured. In Pittsburgh, she co-founded the Pittsburgh chapter of Physicians for a National Health Program. She has authored many opinion pieces on how a single-payer national health system will improve patient care and bring us closer to the goal of social justice. She has also been a guest speaker on healthcare reform and featured on national and international television and radio. Dr. Malinow will continue connecting the privatization dots and address direct contracting entities, a stealth scheme to privatize traditional Medicare through a Trump administration pilot program currently operating in the Biden administration's Centers for Medicare and Medicaid. Dr. Malinow, please proceed.
Thank you, Sandra, for that introduction. And it's great to be here with you. And also a lot of faces that I recognize from California. So this is the beauty, the beauty of Zoom. Really, really nice. So thank you for the opportunity to speak with you all today about this little known program, as you mentioned, out of the Centers for Medicare and Medicaid Services called Direct Contracting Entities. And thank you, Thom, again, for shining the light on the truth about Medicare Advantage. There's just no way for us to understand direct contracting entities without first understanding the flaws of Medicare Advantage. And if your listeners haven't already done so, please read Thom's latest article published in Common Dreams called "The Corporate Plan to Murder Medicare Runs Through Medicare Advantage." It is critical to read that now. It's really great piece, and it comes at the end of open season, otherwise known as open enrollment for seniors on Medicare. So imagine Medicare as a pie chart. I'm a very visual person, and so I like to think of pie charts and graphs. So Thom has written about the 40% of the pie, the Medicare Advantage piece of the pie. What I'm looking at is the remaining 60% of the pie, called traditional or original Medicare Advantage, where there's no private health insurance company, no middleman between the patient and their doctor denying care or asking for prior authorization. Now here, Medicare pays providers directly for their services, as Thom is mentioning, and as we've seen, delivers better care at lower costs. Now, you would think that CMS would want to protect that 60% from the consequences of Medicare Advantage, do everything possible to keep the for-profit corporations from ravaging the seniors that have chosen to stay on traditional Medicare and deliberately not chosen Medicare Advantage, right? Well, sadly, that's just not how CMS works. In fact, they are actively doing the opposite, handing that 60% of the Medicare pie to Wall Street private equity, venture capitalists, and yes, private insurers who already own Medicare Advantage plans. But how is Medicare going to privatize that 60% of the pie? So this is where it gets really interesting. Through a little-known agency under the Centers for Medicare and Medicaid Services called the Center for Medicare and Medicaid Innovation, or CMMI, or the Innovation Center for short, which was created under the Affordable Care Act with a simple mandate to introduce models of care into Medicare that would decrease costs and not worsen care. Now, as we know, in a for-profit healthcare system such as ours, that's like squeezing water from a rock. Just not going to happen. But okay, they were optimistic, so the ACA gave full authority to the Innovation Center to roll out any model that they deemed fit to all of Medicare without congressional approval. So since 2010, they have piloted 54 experiments to the tune of $10 billion, 50 of which have failed. And the 5 that sort of met their criteria were all, for the most part, very small disease-specific programs. So instead of scrapping the entire program, right? I mean, when you only have a success rate of 5 out of 54, they have yet another $10 billion in the next 10 years to keep pushing the same private market-driven failed models, but this time with Liz Fowler at the helm. And for those of you who remember Liz Fowler back from 2010, she was the major architect of the Affordable Care Act, the ACA. So instead of looking at a proven model such as single payer, which has evidence from other high-income countries that have shown to control costs and deliver better health outcomes, the Innovation Center has gone all in for the direct contracting model, developed, just as you mentioned, under the Trump administration and now sanctioned by the Biden administration. So when you ask the question, what is the global and professional direct contracting model? Well, the model is based on the flawed idea that the only way to save money in our healthcare system or in Medicare is to contract out what they're calling de-risking healthcare to middlemen who know how to deliver care at a lower cost. So that's their idea. That's their basic premise. And where is the evidence for this? Well, nowhere. We know the evidence doesn't exist, but evidence is no match for profit. These direct contracting entities, or the DCE middlemen, have been created whole cloth by Wall Street. They're venture capitalists, private equity firms, Medicare Advantage plans, SPACs, PCPs, MSOs, ACOs, an alphabet soup of for-profit corporations, mostly investor-owned, some publicly traded corporations that we are expected to believe will deliver care for seniors at lower cost without compromising quality. And 53 of them already have contracts with CMS. They operate in 38 states and DC and will have access to the 30 out of the 38 million seniors that have deliberately, specifically chosen traditional Medicare. That's 60% of the pie, which, by the way, in 2025 is projected to be worth $720 billion. So the stakes are huge here. But how do you get seniors who have specifically chosen traditional Medicare to switch to a direct contracting middleman? Well, you don't tell them. You lure their primary care providers to participate in a DCE by promising the doctors much better Medicare reimbursement rates. And once the doctors sign up with a DCE, all their patients are automatically aligned by CMS with the DCE the doctor has chosen. So the DCE sends patients a letter, and I have seen some of these letters, and that many seniors are likely not going to read, or if they read them, they won't understand them. And presto, millions of seniors previously on traditional Medicare now belong to a DCE. The plan is so outrageous, it should make everyone's jaw drop. I mean, it's almost brilliant in how nefarious this is. The Innovation Center has publicly stated, and I quote here from their website, all Medicare fee-for-service or the traditional Medicare beneficiaries will be in a care relationship with accountability for quality and total cost of care by 2030. Now, what does this mean? It means that by 2030, all Medicare will be fully privatized and in the hands of Wall Street investors. And there is no reason to believe that DCEs won't behave just like Medicare Advantage plans, right? They're going to cherry pick healthy patients and lemon drop sick ones. They're going to deny care, upcode, as Thom was talking about and he has written about, and spend as little as 60% on healthcare for beneficiaries. Now, let me remind you that even Medicare Advantage has to pay 85% of their revenues on healthcare, and DCEs will only have to pay 60%. That means that they're taking home 40% in profit. So now what do? We wring our hands, we just, feel awful. Well, how do we raise the alarm? Our tactics for the next few months are twofold. One is going to be, and this thank you to a bunch of activists from California and Vermont and that met together over this weekend. And the tactics are going to be twofold, as I said. One is going to be education, and the other one is protest. So the three things that people can do is, one, we must educate the public and our elected officials about DCEs. As we started talking about, and as Sandra said, this is a little known program from a little known agency. This is a stealth program for a reason. CMS does not want us or even our public officials to know. It's time we raise the alarm by educating public and Congress. And how do we do that? Well, we call our congresspersons, we write letters, we write op-eds, we flood the airways just like we're doing right now, and the podcast and the social media. We tell everyone what will happen to traditional Medicare and what will happen to Medicare we are fighting for, because that's really what it is, right? There will be no more Medicare to fight for if everything is privatized, either through a Medicare Advantage plan or through private equity plan. Number two, today, right now, you go to the PNHP website, which is pnhp.org, and you sign the petition demanding an end to direct contracting entities. We will be delivering almost 7,000 signed petitions to Health and Human Services Secretary Becerra on November 30th, and then meeting with members of Congress to educate them, and then ask them some hard questions, because honestly, even as much as I have read about DCEs, I still have so many questions. And three, protest DCEs where they live, in their headquarters, in their offices, in their towns. Now, there are 53 DCEs in 38 states and DC. So my guess is that there's probably one near you. 28 of them are investor owned. 6 of them are owned by Medicare Advantage plans running DCEs. So National Single Payer is collaborating with March for Medicare for All in the month of December to protest in front of DCE offices. And in the holiday spirit, we're putting on skits about how the Grinch stole Medicare and leaving bags of coal at their door. Now, you have to find which DCE is operating in your state and organize a protest. And we're putting together protest packets that will be available shortly, not quite yet, but shortly, at our website at nationalsinglepayer.com and m4all.org, and that's with a letter, with a number 4. So, you know, I want to end by saying that this is a winnable fight. This just at the pilot stage, and so this is our opportunity to really strike hard and strike now. You know, goodness knows that Medicare for All activists really need a win, and I really think that we have one here. So, thank you.
Thank you so much, Dr. Malinow. I put the link for the petition in the chat, and I don't know if you have handy. I know I attended a meeting a couple of weeks ago with your group, and someone had found a link to the where the entities were per state. I don't know if you have that. If not, I will, after this meeting, I will try to find it and send it to all the attendees. I know in Virginia, I did notice there are 2 in Virginia.
It's in the CMMI website. If you just Google CMMI DCE, the very first paragraph will have a link to the 53 DCEs.
Thanks so much. Okay, now we're going to move into what'll be a fun segment. Thom and Anna are going to engage a while in an unstructured roundtable discussion between themselves. Before they begin, I want to remind our audience to write your questions for our speakers in the chat for the upcoming Q&A. Okay, Thom and Anna, jump in.
So Anna, where do we begin here? I mean, the petitions are great. Calling members of Congress is great. Anything beyond that, this is outrageous stuff, the DCE thing.
Yeah, I agree. And I do think that Medicare Advantage, of course, is outrageous, has been outrageous for years and years. But I think that it's going to be, the fight is much harder against Medicare Advantage than it is for these DCEs. These direct contracting entities really are at their incipient stage. There are only 53 of them, so we have to demand that no more DCEs get enrolled, no more people get enrolled into the DCEs, and we need to terminate altogether. So I'm a huge fan of you know, taking it to the streets. That I think we should protest. There are 53 of these, and I know, for example, my friend and fellow activist Kate Tillow, whom some of you probably know, is going to protest in front of Humana headquarters in Louisville, Kentucky. And they're going to be putting on skits about how the Grinch stole Medicare. And if you guys are interested in the poem that I co-wrote with another one of our members, and then delivering coal. So, I mean, these are small actions, but I think this is how you start.
Yeah, it seems that kind of theater should be happening at the offices of all of our elected representatives. Federally.
You know, it's really interesting that you say that, because that's really what we need to do. But it's as though I'm going to be giving them the benefit of the doubt that they don't necessarily know about direct contracting entities. And once they do know about direct contracting entities, then that's when we protest their offices and in front of their homes or wherever it is.
Wouldn't the protest cause them to know about it? You know, they'd see people outside go holding signs about DCEs and go, what? Somebody tell me about this.
Yeah. So maybe, it's more of a demonstration rather than a protest. But yeah, I agree with you. I think that we need to make some noise.
Yeah, I'm going to start in a big way. I did not realize it was this far down the road, and I've read about this and heard about it. But
I know. I told you about it in your program.
Yeah,
you interviewed me. Thom, I have a question for you regarding Medicare Advantage, and it's a question that I get asked all the time, and I just don't know how to answer it. And that is, isn't Congress aware of how much Medicare overpays, or how much the government overpays Medicare Advantage plans?
Sherrod Brown is certainly aware of it.
It's no secret. So if it's no secret, why don't they do something about it?
Because the health insurance industry is a multi-billion-dollar industry, and a few $1 million spilling out of their pockets into the campaigns and down the throats of every politician in America is nothing I mean, you know, they basically have to buy off about 400 people in Washington, D.C., you know, to get a majority of Congress. And they've got pretty much the entire Republican Party, and they've got, you know, a sizable chunk, you know, of the Democratic Party. And, you know, sadly, you know, there's a couple dozen, certainly in the House, very bought out Democrats, you know, the Kurt Schraders and Josh Gottheimers, the so-called corporate problem solvers. And then you've got Kirsten Sinema in the Senate, who Big Pharma just last month spent $1.2 million in Arizona just running ads telling everybody how wonderful she is. You know, since the Supreme Court told us all in 2010 with Citizens United that pouring money down the throats of politicians, you know, is no longer bribery. It's no longer political corruption. It is First Amendment protected free speech. All the brakes are gone. There's nothing to slow this down, nothing to stop it. And I'm just astonished that we've gotten as much done as we've gotten here in the last year, you know, with the Democratic administration, because, you know, these people who are totally bought off keep popping up. So I'm guessing that probably, you know, the majority of Congress doesn't know the details of how bad the ripoff is, but they know there's something shady going on here. But hey, you know, they just gave the military industrial complex $25 billion more than the president asked for. Corruption is nothing new to these people.
Right. Yeah. I mean, I was afraid you were going to say that.
We've got to get money out of politics is the ultimate answer. It's the cancer eating our democracy alive.
Mm-hmm. Mm-hmm.
So maybe there's some questions, Sandra, do you, or whoever was.
Sure, if we're ready for Q&A, I am guessing that our steering committee members, Paul Norsey and Angela Vullo, who've been monitoring the chat, can select some of questions for you. So let's do that. Paul, let's start with you. Do you have any questions?
Yeah, so the first one I have prepared is for Thom. Thom, Medicare Advantage has always been a Trojan horse, as you said, to privatize Medicare. Many reports, including reports from the Center for Public Integrity, GAO, and HHS, have found that these privatized plans cost Medicare far more than Medicare, ripping off taxpayers to the tune of billions of dollars a month, while providing less health care than original Medicare and Medigap plans. The report also reveals, these reports also reveal that the Centers for Medicare and Medicaid, CMS, are failing to recoup billions of dollars and are instead promoting the plans. If passed, how will the provisions to expand Medicare benefits under the Build Back Better budget not fall prey to this escalating privatization scourge? And won't they make universal single-payer healthcare like Medicare for all difficult or impossible to implement?
Yeah, unfortunately, I don't know the answer to that question. The Build Back Better legislation was not widely and publicly available prior to the vote, and it presumably now is, but those kinds of details tend to be buried in arcane language that says, you know, in this number bill from 7 years ago, you modify this word to that word, you know, and it's just without hours and hours and hours of work, it's hard to figure it out. That's the sort of thing that I'm guessing some of these groups that are very invested in this, Social Security Works, Physicians for National Health Program, and others might be looking at. Anna, do you have an answer to that question?
No, I don't. And that was my major worry about the whole expansion of Medicare under the Build Back Better, the reconciliation bill. It's very worrisome. What's going to happen to you know, the 60 to 65-year-olds? Are they all going to be sort of shunted into Medicare Advantage? You know, there would be so many corporate interests pushing for that, right? For one, employers are no longer going to have to insure their their oldest and most costly employees, right? The 60 to 65-year-olds, they're just going to be sucked over into Medicare. So that's number one. And then number two is, are they all going to be, you know, sort of pushed into Medicare Advantage plans. And I don't think that there were any guardrails against that.
Yeah, it may be part of one of the notorious compromises. You know, sure, Bernie, we'll give you hearing aids. Just give us everybody between 60 and 65. But who knows?
Paul, do you have another question for us?
Yes. So to Dr. Malinow, the Trump administration's CMS attempt to launch GEO direct contracting in its waning days. So they attempted to do that, but the Biden administration paused it. CMS is believed to be considering an additional solicitation for another set of DCEs. Currently, CMS has stated publicly no limits on the growth of DCE networks and geographies. Does this signal DCEs are going to be sanctioned by the Biden administration?
Yes. Now, let's back up a little bit because this is very confusing. So, of course. So the Biden administration started this, the direct contracting model, which they called the GEO model, which was even worse than it is today. The GEO model would have taken all of the traditional Medicare beneficiaries in 10 cities across the United States and then just automatically aligned, right, to a direct contracting entity without the ability to opt out at all. And so everybody and I forget the cities, they were Atlanta and I don't remember them. And I knew them at one point very well, but I have forgotten them because they have paused that program. They have decided that when Liz Fowler came in, she said, we are not going to pursue the GEO model, but what we are going to do is we're going to pursue the GLOPRO, which is the Global and Professional Direct Contracting Model, which is based on the GEO model, but instead of being in different geographies, it is now for the entire country. And they do seem to have a few more little, what they call guardrails, but it's sort of basically the same idea, but it is not just limited to those 10 cities. Now, it's really interesting because they were supposed to be open for more direct contracting entities to sign up in January 2022, but they have put a hold on new applications. I have no idea what that means. I have no idea, but I can tell you that it's still not good. It's still not good because if you read the CMMI vision for the next 10 years or so, it's all about de-risking. It's all about privatizing traditional Medicare. It's just as what I said, it's aligning them into these accountable relationships, which is just gobbledygook for privatization. So they're putting a hold on these new applications to the consternation of industry, because industry sort of doesn't know what's going on either, because industry sees $700 billion and their eyes are going ching to ching, right? But we haven't seen the end of DCEs, for sure we haven't.
Wow. Okay, Angela, how about you? Can we hear your first question?
Sure. This is okay. As MedCat confirmed recently, over 35 years, privatized Medicare has always cost more than traditional Medicare, not less. Why do you think this irrational waste of taxpayer money has not been exposed and opposed? Thom?
Because the Supreme Court made it legal to buy off and bribe members of Congress. I think it's really just comes down to that. Anna, do you want to add something? Do you agree with me? Yeah. Okay.
Okay, that's pretty straightforward.
Yeah, no. I mean,
Angela.
I agree. I agree 100% with Thom. Yeah, absolutely.
Okay, all right. Okay, Anna, researchers estimate that DCEs may spend as little as 60% of revenues on patient care. What percent of revenue is spent on Medicare Advantage care versus original Medicare supplement plans? Again, why hasn't this been exposed? Why is it allowed to continue?
All right, we are here exposing it, right? This is our job today. I think that I mentioned this. So when you talk about what is known as medical loss ratio, the MLR ratio, that is the amount of money, which is really interesting. It's an industry term. Medical loss is the amount of money that insurance companies lose when they pay for real health care for their beneficiaries. And so that's the medical loss, what they call ratio. The ACA actually made it so that, I mean, it used to be all over the place, but under the ACA, private insurance companies now have to pay at least 85% of their revenue to real health care. Now, let's compare numbers. Medicare, traditional Medicare is about 97 to 98% goes all to healthcare, and only 2% go to administration and prevention of fraud, actually. Under Medicare Advantage, it's 85%, although I believe that during the pandemic, it was allowed to go down to 83%, something like that. And then the DCEs will apparently only have to spend 60% of their revenue on healthcare.
Okay. I want to ask something myself, and I see lots of great questions being pushed out into the chat. We see now in the open enrollment period, and it's increased much more this year than I've ever seen it, although each time it gets worse, multi-million-dollar ad buys constantly on TV all day long. I'm thinking that basically hawking the fabulous Medicare Advantage plans that will give you all these more for less. And it is extraordinary to me. You don't see, and I don't think we're so accustomed in the United States to being bombarded with propaganda all the time on ads and selling something, that I doubt that most of the American people who are hearing this and eligible to sign up, it occurs to them, where are these multi-millions dollars coming from to put these ads up? Which is, of course, as we know, from the Medicare fund, taxpayers. So, and you don't see them wasting. Maybe I've seen one ad for Medicare supplement, maybe, everything is that. How is that allowed? I mean, it's, I think someone may have put something in the chat about what about truth in advertising? I mean, since we all, I know you two and I have looked into this a little, they're asserting things and scamming people. They're promising things we know are not true. They don't even mention Medicare supplements. And I just wonder what in the world can be done about this and why are we, the taxpayer, paying for ads and we know we are. Can something be done to stop that? And whoever wants to go first, if anybody has a comment.
Well, it would take some kind of regulatory oversight. To the best of my knowledge, the only thing that we regulate in terms of television advertising in the United States is tobacco. We are one of only 2 developed countries in the world that allows pharmaceutical advertising on television. The truth in advertising laws are almost impossible to enforce these days, as a result of a series of Supreme Court decisions over the last 20, well, maybe more like 30, 35 years. There's a chapter about that in my book on the Supreme Court, the hidden history of the Supreme Court, the betrayal of America. So it would take some sort of a serious regulatory action from the Biden administration. I'm not sure they have the authority to do that, or an act of Congress. And like I said earlier, Congress has been bought off by these people. Anna, you want to add something to that?
Well, just what we were talking about before with the medical loss ratio, right? So Medicare actually has to spend 98% of their dollars on healthcare. So that only leaves 2%, and that pays for administration and for fraud prevention, of which, Medicare Advantage has a lot, right? So they don't have a whole lot of money left over for advertising. It just isn't there. Now, when you look at Medicare Advantage and you think of, 15% of their revenue can go to administration, it can go to profit, it can go to buying off elected officials, it can go to placing these ads on television. It can go to calling people. It goes to these, glossy flyers that a lot of us, yes, on Medicare, get in the mail all the time. I mean, that's basically, we are giving them that money so that they can spend it against us.
It's crazy. I would like to, before I go back to our other steering committee members, I wanted to share with you something that I just recently found out about with one of our members. I recently found out that the Fairfax County Public School System, their human resources and teacher retirement departments, when teachers come to them, only inform their teachers about Medicare Advantage plans. And they never even mention Medicare supplements as an option. Additionally, I have discovered that some of the community clubs like Kiwanis are also sending their member advertisements to call for free advice on Medicare Advantage plans, and without mentioning supplements. I looked at the bottom of the letter from Kiwanis, and it said it had a name, Vice President for Affinity Groups. Now, I'm looking into this, but I suspect that in school systems that always need money for things, and for these community groups that always need money, I bet my guess is that these people are being paid commissions.
They are.
Now, and I will tell you, we're looking into this. I know one of our members and I met with a school board member recently and informed her about this. And what is this about? These are gimmicks. These are our schools. These are community clubs. How is this allowed? Are you aware of this going on? It flabbergasted me.
I'm very aware of the fact that these companies are throwing commission money around like there's no tomorrow. Mayor de Blasio in New York City just flipped all of their retirees into Medicare Advantage, or the majority of them, I guess. And my doctor here in Portland, they send me a note about, it's time for your annual, whatever it was. It was my physical, actually. And, I logged into the website for my local physician, and here's an ad for Medicare Advantage. And as I'm logging out, before it'll log me out, it says, would you like to click here to get more information about Medicare Advantage plans? And they were not, this is a small physician's office, but they've got a deal apparently with this particular insurance company, and they're probably being paid. In fact, not probably, I'm certain that they are being paid on a click-through basis, or on a per sign-up basis. And there's big money here. These commissions could be really, really large. Anna, do you have any details on what?
It's endemic. It's endemic. Everywhere you look, you will find universities, even colleges, advertising Medicare Advantage plans.
Yep.
Like health systems advertise Medicare Advantage plans. Yeah. Mm-hmm.
But our taxpayer money are paying for the ads. I just can't believe there's nothing we can actually do about this.
Well, we need to get a couple of politicians. We need to light a fire under a couple of really outspoken politicians. Sherrod Brown was all over this, 2 years ago. I'm going to reach out to him this week and see if we can get him on the air. Not that my show is going to move any big numbers, but maybe we can.
It'll help.
Light a fire under some people.
Paul, and Angela, have you been checking the chat? I'm seeing there were a bunch of great questions in there. Paul, do you have anything to?
Well,
another question?
There was Alfeca and a few others asked about, where does AARP stand on this? They're a huge group. They're supposed to be acting in the interests of retired people.
AARP is not what you think it is. AARP is a front group, mostly for United Healthcare, and has been for years and years. They are an insurance salesman or sales agency that has some side benefits of, hey, we can get you a discount at the national park. And we publish a nice little newsletter, but their business is selling insurance.
Wow. Okay.
That's right. I think we need to really partner and work together with organizations that truly represent seniors. And AARP is not one of them, because AARP, as Thom said, is the front group to sell you health insurance. So, but there are lots and lots of senior groups, and those are the groups that we really need to be working together with. So if you know them, invite them and get them to write petitions and to get working to protest DCEs and to become more aware and get them involved.
One of
Can
the
you
comments in
recommend any?
the chat was, if not AARP, then who?
Any recommendations of
Yeah.
senior citizen groups that are accountable to actual real people?
Nothing the size of AARP, is there, Anna? I've always refused to join AARP because I figured out when I was in my 50s, when they first started soliciting, I'm 70 now, but when they first started soliciting me, that they were just, hustling insurance. But I've never been solicited by any other seniors group.
Well, because they probably don't have the kind of money.
Right.
So for example, the California Alliance for Retired Americans, but I believe that's in California. I don't know if they're elsewhere. The Gray Panthers would be another one. And there are smaller groups as well. Yeah.
Nobody has that kind of national footprint or horsepower. I've just walked by the AARP headquarters in Washington, D.C. when I lived there, and it's a palace. It's amazing. It's just amazing.
But as someone in the chat said, it has a profit and nonprofit arm. I mean, one of our folks in the chat and myself, we got our Medicare supplement plans through AARP, but of course, they're also selling Advantage plans.
Right. And if you got a supplement plan through them, I'm guessing it was United Healthcare.
You bet. That's it.
That's their exclusive provider. They are basically a front group for United Healthcare.
Yeah. So I guess they can do that as long as they get those Advantage plans out there. Okay, Paul, do you have another question for us, please?
Let's see. Looking through the chat, let's see.
Well, while he's looking, what is the amount of co-pays for the Advantage recipients?
I don't know.
Well, copays, I think that they just went up, right? Thom, you mentioned
They
it.
did slightly, but I'm sorry, I don't have those numbers.
Okay.
Brain or
Yeah, they went up from 160 to 170 or something like that. Well, maybe
I don't think that's the
49.
copay. That's the premium. The premium
Oh, that's
went,
a premium. I see.
yeah,
I see.
it
The
went from
copay?
148.50 to 170.10.
Yeah, copays for the Advantage plans.
Yeah, I think
Is that the
that's going to
question?
vary from company to company.
So it is going to vary, but you know what the Advantage plans are pushing now are zero premiums, $0 premiums.
Right.
And how can they do that? Well, they're doing that because they're making the Part B beneficiaries pay more money due to the upcoding of Medicare Advantage, right? So that they can turn around and offer these $0 premiums to recruit more patients, to more beneficiaries to come into their plans. It is brilliant. You've got to give it to them. It's
As parasites, they're very ingenious.
Yeah, they are. And then we're stupid, right? I mean, we fall for it.
Well, and the thing is, I look at, your average person. I look at our recent election in Virginia, where some very effective GOP bumper stickers seem to get through, because one thing, Democrats, since we govern, we actually do care about policy, and we go into depth, and we know it's nuanced. And bumper stickers work. I look at the complications here. How in the world it takes in this group, we're talking at length to try to grasp a little bit about the aspects of this. How do you put this on a bumper sticker to basically get through to the average American?
Save Medicare.
Okay, that's good. I like that. Thank you. We'll make bumper stickers. Right.
Not bleeding Medicare.
Yeah, save Medicare from venture capitalists.
Yeah, Save Medicare from Wall Street.
From Wall Street. Mhm.
Okay. Okay, Angela or Paul, do either one of you have any more questions for us?
Well, this is related. This reminds me of how George Bush tried to privatize Social Security, but there was huge outrage and it was stopped. This is so much more insidious, both Medicare Advantage and DCEs. It is never described as privatizing Medicare. People don't know what privatization means, but they don't understand it when it comes to Medicare Advantage, and probably most people have never heard of DCEs. I agree with the petition, but counter advertising would also be great, and medical doctors joining in so many seniors trust their doctors. So could you comment on this?
Well, I can address the doctors joining in. You know, the sad part about it is that, at least regarding the, well, yeah, we're complicit in many ways. So for example, we are also complicit in upcoding. Not I as a pediatrician, I can excuse myself because I don't see Medicare patients, but internists and family physicians will also be upcoding as well. And then as far as the DCEs, the doctors are being roped in by promises for better reimbursement rates in Medicare. And when they're roped in, what ends up happening is that they bring all of their patients with them. So if the doctor signs up on a DCE, then all of their patients get aligned by CMS to that DCE that the doctor has chosen. So that kind of complicit behavior really is terrible and has to stop. So that's why we have Physicians for a National Health Program, and that's an organization of 22,000 physicians that support Medicare for all. And this is what we're doing. We're going to Washington. We're delivering those 7,000 signed petitions to Becerra, and we will be organizing with other activists against direct contracting entities.
And so Anna, you're going to, I understand you'll probably be sending out that package of information so that we can encourage everyone in the DC area to join the protest. Is this not one open to the public?
Well, this is really interesting. You know, we only have a permit for 30 people in front of in front of HHS, in front of Health and Human, in front of that office. We only have a permit for 30 people. So we're not really getting a ton of people to come out.
Okay.
I mean, yes, of course, if people want to come to DC and join us, absolutely. I don't think we're going to say no, but our push really was not to get a ton of people there. Our push was to deliver the petitions and then and to live stream it and to get the word out in social media.
Okay, we'll certainly do that. Paul, any other questions?
Yeah, so kind of following up on the doctor's question is, do most doctors, Rochelle asked, do most doctors who see Medicare patients know about the reality of Medicare Advantage and about DCEs? And I'd add to that, where does the AMA, the American Medical Association, stand on DCEs, for example?
I don't think that the AMA has come out publicly for or against DCEs, so I can't really say. I think that they have always been a friend to privatization and to, so I'm not sure what their position is on Medicare Advantage. You know, it's sort of this love-hate relationship. They certainly, the AMA has always been against single payer, and they have said so for decades and decades and decades. But they also don't have a very friendly relationship with the insurance industry either. So I think that it's sort of conflicting relationship there. I can't tell you what their position is.
Any comments, Thom, on this issue?
No, I'm not a physician. I'm not.
What you know. Okay, Angela, how about you or Paul? Anybody else? We're getting close to the end of our Q&A, but I would like to entertain some other questions, a couple more if we have them.
Okay, here's Bob Griss, okay. Medicaid managed care has always provided protections for people with disabilities. Why are these patient protections not applied to Medicare Advantage, which serves many people with disabilities and chronic conditions?
Because the politicians who put together Medicare Advantage in its current form in 2003 were being paid off by the health insurance industry. Anna, you add to something to that?
Always comes back to the same thing, doesn't it?
Really
But go
does.
ahead, Anna.
So, you know, it sort of depends on whether I'm going to be kind or cynical. So in a very kind Pollyannish worldview, I can say that maybe CMS honestly believes that the way to save Medicare is really to de-risk it and to use value-based care and to put everybody into accountable relationships with their providers. You know, maybe they honestly believe this. Maybe they do. Maybe I don't know. This could be a possibility. But my more cynical and realistic version is that Congress is bought and sold by the medical industrial complex.
Yeah, it's, I mean, maybe the moon is made of green cheese, but I doubt it.
Yeah. Okay, one last question, and then I'll ask our speakers if they'd like to make any more, any closing remarks. Do we have a last question from Paul or Angela? Looks like not, so I think we're at the point. Anna, why don't you make your closing remarks, and then Thom.
Okay, well, I will keep this brief. First of all, thank you everybody for the opportunity to talk about direct contracting entities. I really appreciate all the questions and your interest in this. My parting remarks is, again, that this is a winnable issue. We are at the beginning. This is still a pilot. And so if we're going to win this at all, this is like as if somebody had told us, well, you know, we should really start thinking about Medicare Advantage back in 2002 or something, right? This is the time to strike. This is the time before it actually gets scaled up to all of Medicare, and then there's no turning back. So this is a winnable issue. And as I said, as Medicare for All activists, we really need a win, and this is the way to do it. So thank you.
Thank you, Anna. Thom?
I would just say that without citizen activism, we can't have a functioning democracy. And so I would encourage everybody who's on this call to reach out to your elected officials, to tell everybody you know what you learned today, to spread that message far and wide as you can, and you know, help us rescue this program that you know, LBJ put into place back in '66 that is just so valuable and so useful, and you know, and stop it from being turned into another cash cow for Wall Street. So you know, I guess my final message is tag you're it.
Perfect. Okay, audience, this concludes actually the speaking portion of our meeting, but for voting members of ORNOVA, we request that you remain, because we're going to have a second segment. It's going to be an important business meeting. So stay here after we thank our speakers and the non-voting audience. Please stay in the meeting. So on behalf of our organization, I would like to thank our outstanding speakers for providing us with in-depth insight into and exposing the schemes of the for-profit parasites, destroying the only part of the US healthcare system that actually works to deliver healthcare, traditional Medicare. Thank you all for attending and participating. Please use the information you learned tonight to expose the truth and take action to stop the privatization of Medicare. We will, with the help of our friends tonight and others, send you updates from the front lines as we have them. And we hope to see you all at our next meeting. And I bid all of our non-voting attendees and our speakers good night. We're going to pause a minute for folks to leave, and then we're going to resume for new business part of the meeting with ORNOVA members. So we'll pause now and wish you all goodbye. And for the non-voting members and our speakers, thanks so much. We really appreciate you all.
Thanks, Sam.
Thank you very much.
Great
Bye-bye.
to see you, Anna. Thank you.
Good night. Nice seeing you, Thom. Bye.